I greet our esteemed colleagues from all the higher education, from the Health Professions Council, from National Health, and all other colleagues in the field. I think Gauteng EMS, we all know, it's a very unique province when it comes to EMS in that historically we have services that are being done by the municipalities and also the provincial service. Also, Gauteng province, we know the population is about 11.3 million, and EMS is a vital part of service delivery when it comes to ambulance and emergency care. I think the importance of education and training has evolved along the years. I mean, previously we used to focus more on the EMS environment, on short courses, but I think with higher educations and the partnerships that are involved over the years, we've come to a stage that even with the assistance of National Health and the professional body, the Emergency Medical Board, we're transforming EMS into the nested policy where we're actually formalizing our courses into national qualification frameworks. If you look at the other bodies like the nurses and allied institutions where they actually went through a similar phase where their short courses were actually phased out and they came to the national qualification framework of all their qualifications. And I think for EMS, clinical competence is very, very important for EMS. If you look at the industry and you compare us to the developed countries, there's a lot of litigations that take place in the EMS environment. And I think for us as Gauteng Health, we want to protect our employees and also the industry. If you look at it, that's why we're partnering with the UJ on projects and also other higher education institutions that we want to take EMS forward in clinical governance. So I think even with our mandate, one of our mandates is for all EMS, we should actually have a clinical director that should govern EMS cases and actually also lead and train people and motivate people in the industry. I think just with our partnership with UJ and also with them partnering with Philips, I think we appreciate it because the two projects that they actually assist us is one is on the ambulance project that's going to focus on mother and child inter-hospital transfers of the high care environment where Philips actually will use their technology to show what's been rapidly changing in the environment of patient care. And I think also for our staff, it'll actually give them more training and more insight into exactly what happens pre-hospital and also in hospital. Because I think our environment focuses more on pre-hospital, but we don't see that continuation link between the two. So I think we appreciate the partnership with Philips and with UJ. And also I think we've been working with many years with UJ. We have one of our response units that actually go out and do that's been allocated to UJ, and they do primary responses to all emergency cases where they take students as well and do training with them. So from Gauteng Health, I think we're grateful for the project and we support the project. Thank you.